Senate is not signing off on that bill, and right now the Senate and House aren't even talking, and they're waiting out the decision on what we call those vouchers. And from my understanding, we know that there are 20 House Republicans right now who are opposed to the voucher bill, and it's not going to be easy for the governor or Senate to insist on those vouchers. But why we're concerned, I think, from an advocate standpoint, that's certainly, there's schools always on the on the front end of the mind of people with disabilities, but there is $30 million right now in the budget that would help us go towards our advocacy points as the DD Council. That could go to support direct care staff. There's a significant amount of dollar money in there for rates for staff. There's also money in there to address waiting lists, and there's also money in there to address rural services. So if the Senate can't win on the vouchers, that could be trouble for the House when they're trying to finalize that budget. So it's a good opportunity. While they're maybe arguing over the voucher standpoint, we really want to try to see what we can do to advocate on those 3 points, making sure that wages are increased to kind of address the staffing workforce issues, continue to address the waiting list issues, and then continue to provide services in the rural areas. So those are kind of how I'm seeing it. We're going to maybe pause for a second and celebrate some of the bills that did get passed and some of the ones that are at the governor's desk, but then maybe you can clarify some points I made there.
Yeah, Bill, I got it covered. Oops. I had a little feedback there. Sorry about that. I think you had it covered. The legislature hasn't really been back at the Capitol much since April 19th. They've been working one or two.
Hold on a second. We're having some trouble with audio. Carol just said I have no audio. Or if you raise your hand, if you're having trouble with audio, how many people? Just want to do a double check here.
Okay, can anybody hear?
I can hear.
Okay. Yeah, there was a little feedback. I don't know where that came from. So let's make sure everybody's muted so we don't get anyone popping through. I think it looks like everybody's muted, but if you're not, please mute yourself, or maybe Emily can take a look and mute folks. All right, well, I think you had it. The legislature has not been meeting much since that 100th day. This week they came in 2 days and worked, which was about as much as they've worked in a month. So they did get some bills signed into law. As of last week, there were only 8 bills that were signed, but then the governor later that day signed into law 20 more bills. So there's still a good number that are ready to be signed, but they haven't been messaged to the governor yet to get the signature done. So I think a lot of bills are just being held right now. But the legislature had a list of must-dos, Senate leaders, House leaders, and of course, one of the must-dos is budgets. That's always the one thing that they always have to do. And the other things were things like biofuels and unemployment reform. The legislature got everything done except for, as you mentioned, Bill, what they call the voucher bill, which is using using public education money, public school money to send kids to private school. And so that is the thing that is dividing the legislature right now. And it's dividing Republicans, House Republicans and the Senate Republicans, and the governor do not agree right now on doing that. Last we heard, there were a lot of votes in the House that were missing to pass the school voucher bill. So the Senate's saying you have to pass that before we do budgets, and the House is saying there's no way we can do that. So that's where we are. And there's a lot of things just stuck there. But I wanted to mention that the governor is signing those 20 bills into law. 3 of them were on our list that we had been following this week or this session. One of those changes the definition of autism to make it a mental health condition. So that lines up with how your health professionals diagnose autism. They use a book called the diagnostic manual. And so this is consistent with that. It also happens to make that subject to mental health parity, which means insurance companies have to pay for the services equal to what they would pay for like a physical health service. So there might be some implications there, but that bill was signed into law. That was an Autism Speaks bill. And then Senate File 2197 is the bill that some parents of children that are in private schools had been pushing for. They were unable to get their children the special education services that they were entitled to at the private school setting. And it is required by federal law. So this was not widespread, but it was in certain area education agency or AEA areas. So there's going to be a special education task force to look at what's going on and how to make sure kids, no matter where they're at, get the special education services they're entitled to. And then finally, the newborn screening updates. You may not know this, but when you have a baby, they get a blood test and they go through a panel of screenings for various genetic diseases and conditions. And that hadn't been updated for a while. So I know, Bill, someone on your council was really working hard on that bill.
That's correct. Carol Cross, she's on there today, but she's definitely did a lot of advocacy. She spoke at some of the committees and did a lot of follow-up with her own legislator. And one thing about all three of those bills that were signed into law, they have some beginning roots of self-advocacy. Somebody with just like we've talked before, how do you introduce a law? A legislator certainly does that, but they have to have that idea generated from somewhere. And sometimes it's their own, but often it's someone with a lived experience. And in these three cases, they're ones that are lived experience with people that are either family members or are people with disabilities that started to advocate, or at least were part of forming that wall. So Carol is one of our council members, and just really did a great job in advocacy and speaking up and telling the story of her family. So those really make a difference.
Yeah, and thank you. Sorry if I'm sounding a little shaky today. I have really bad allergies, and so my voice is kind of having a hard time keeping it a voice today. But also, there are a couple other bills that I wanted to make note of that we've been following and also have roots in self-advocacy. House File 604, we learned, Bill, didn't we, during one of our Capitol snapshots, that that bill had been going on. The attempt to pass the language development milestones for children who are deaf or hard of hearing had been going on for decades. We didn't realize that and how many legislators were involved in that. But that bill really just directs the Department of Education to put together a set of milestones for kids who are deaf or hard of hearing, and resources parents can access to help make sure their kids stay on track and are ready when it comes time to go to school. Because a lot of kids that are born deaf or hard of hearing cannot, and the parents don't know what resources they have to make sure they can communicate with their kids and make sure that they're school ready. And there were some pretty surprising statistics around school performance and readiness there. House File 2252 allows a person, this was a department bill, but Department of Human Services bill, but it allows a person with a permanent disability to receive child care assistance. Right now, before this bill was passed, you could only have a temporary disability and be able to get child care assistance. And it's clear that that families of somebody with a permanent disability also need that child care assistance. So that was one of the changes in a much larger Department of Human Services bill. Also, there's a couple others that you can take note of there. There's a bill on financial exploitation of dependent adults and older Iowans, making it a crime, and it makes some additional changes there. as well as allowing more health professionals to sign documents needed to get accessible parking permits. And Senate File 513, I know a lot of the mental health advocates had been working on that, allowing law enforcement to keep reports confidential when they're approaching somebody or have approached somebody that's in crisis, either a mental health crisis, a substance use crisis, or housing crisis. So somebody that might not have housing, somebody that's homeless. And so oddly enough, the Newspaper Association was really not wanting to make this change. They thought it was a way that law enforcement would keep other reports confidential and not open to the public. But they were able to come up with a compromise that just allows police officers to make some notes in their files about these individuals that wouldn't be made public. So things like, if you have somebody that is frequently in contact with the law, they might make note that don't stand next to this person, make sure that you know, look at them, or it just notes to help them reduce the to de-escalate the situation. So just notes about that. So that's not something that needs to be public. I was going to move on to the budget, just oh no, what do I have here? Sorry.
Amy, just really quick too, one thing that you said in the beginning there is that some of these now, so those bills you just listed out definitely still affect people with living in Iowa with disabilities, but they all are now at the governor. So the governor could sign those and those could become law. And if both the House and Senate are agreeing upon those that there's probably a likelihood that those could go through. So we continue to watch those. But it was a strong reminder this year, especially that first one, House File 604, that as the legislators talked about that getting passed, they had been working on that for years. And they talked back to the beginning part of when they first saw the draft of it. And so in a way, it's kind of encouraging that, you know, now the sessions will be winding down. It's a time this summer to work on things that are important to you, to start meeting with your legislators about those issues or with your advocacy groups, and to do work during the off season so that they can hear those messages, but also that sometimes these bills do take a long time to become law. And so it could be encouraging or discouraging, depending which way you may look at that. But at the end, that's a positive bill that's going to be moved forward, we hope, when the governor signs it. So just a plug on that a little bit.
Yep. And Bill, yeah, that list that I just went over, it says sent to the governor. It means the legislature's done. They passed it.
Yep.
When they send it is a matter of, I don't know when that happens. It's just when when the legislature actually sends those bills, but they will be available for signature sometime. So I would, you know, the governor has something on our website that allows people to submit comments, and you can do that, or you can do that through our Take Action Center on infonet.iowa.org. That allows you to send messages to the governor as well. So all of those, the action of the legislature, it's done, it's passed. We're just waiting to see what the governor does to that.
You can directly contact the governor. So just real quick before we go to the next one, then we had a question from Chad Webb in there in regards to the voucher. And he asked, how does that directly affect people with disabilities or families with disabilities? And right now the voucher system, I mean, if you did have a child that had a disability and you wanted that money to follow them to a private school, that could on an individual basis help them. But in a larger sense, it is really around the voucher program is allocating some state dollars to follow a child from public school to a private school. And so it's more for children as a whole, maybe not just specific to children with disabilities, but it is holding up the bill. It's holding up the final passing of the budget, which Amy, you're going to get to. And in that budget has some really important line items for people with disabilities. But
yeah, there is other stuff in, geez, allergies. There are other things in that bill, like a parent's bill of rights, that's mostly dealing with the subject matter that teachers can talk about. It goes back to some parents being concerned about the books that kids are reading, are required to read during school, and what's available in a school library and that kind of stuff. More than anything else, that's what that piece is about. But there are a lot of other changes in that bill. It's a pretty big education bill, but the one sticking point right now is just simply the public education dollars being used for private schools. And so that's the big holdup. But I think anything you talk about with education impacts students both with and without disabilities, for sure. I think rural schools are concerned. Urban schools are definitely concerned that they will have fewer resources to be able to help provide services and meet the needs of their kids if public school dollars is being used elsewhere. So it's, we call it vouchers. The legislature and the governor have, it's really a scholarship program, but you'll hear it called various things. This list of bills is actually the ones that have not passed the legislature yet and that we're still watching. So there's some additional, the service assistance animal issue in rental housing, and it goes beyond just rental housing. It's also housing providers. So some of the HCBS providers might be included in that. Trying to balance the rights of individuals who have service animals with the rights of others. And in some cases, dueling accommodations, like one person's accommodation may affect another person. So how you address that. And right now, the language that they're considering is supposedly consistent with federal law. Although I don't know that all groups agree with that. So I don't really think that something's going to pass there, to be honest. I think that's something that will be held over till next session to address. They're still working on how to provide additional funding for children's hearing aids. I think we mentioned in a couple capital chats ago that private insurance views children's hearing aids as cosmetic, so it's not covered. And obviously, to anyone I'm sure here, they are not cosmetic. They are absolutely needed to make sure a child can continue to, learn. And as they grow, they need new hearing aids because the size of their ears changes, the canals change. And so that is quite costly. So they're working on a project. They started out trying to require insurance companies to pay for it, and now they've changed it to a state program with funding available. So it is in the House budget, but we don't know what's going on with the Senate. So the Senate doesn't have a budget yet. So that's something we're watching. And we know there's going to be some election law changes, and it's now too late for that to apply to the primary, but it could apply to something in November. So we're watching that pretty closely. I don't know, Bill, if you had anything extra to say about that. I don't see the chat, so.
No, nothing yet on the chat part. I mean, I think there's some things we can summarize at the end and talk through that I think are kind of clarifying parts, but I just still waiting for action. I just remind the advocates that are on the phone call is that on our Infonet website there, that's on the bottom, the bill tracker, you can link to that bill and read a little more in depth on what it means. But if one of those topics in a large sense means something to you, either read more about it or reach out to me and I can kind of go through what are some of the talking points that they're looking at. But this is still an opportunity, even though they're at a stalemate about the budget. This is an opportunity to reach out to legislators to let them know what you think is important and which bill is important. And they might be at a stalemate, but it doesn't mean we have to stand still during this time as advocates or reminders and to let people know what's important to us. So just my normal commercial, Amy. Talk to them. Use our Take Action Center. It does link directly to your legislators. So, and people have been doing that a lot this year. So we really appreciate that. that tool is something that's useful for people. So.
Well, there's a lot on this screen, and I tried to cram it all onto one screen, but this is something that we had up at the last Capitol chat, and I just copied and put it back in here. It's also been in our this week at the Capitol reports, the weekly reports that you hopefully are getting. If you're not, put something in the chat and we'll make sure with your email, and we'll make sure that you are on the list. Those are also on infonet.iowa.org. On the front page, there's a box that links you to all the Capitol reports that we've put together. But this is what's in the House budget, and it is strongly supporting home and community-based services. It was constructed before the announcement of the closure at Glenwood, but it was definitely in response to the Department of Justice report on Glenwood. So it is trying to help expand the capacity of home and community-based services out in around the state with money for waiver rate increases. So those are to go directly to direct support staff wages, to increase those wages. And I will remind you, this is the state share of that. So that's a match with federal dollars. So there will be, it's in it like almost $2 more per dollar spent, a little higher right now. So that could easily triple in that number going into that, the waiver rates. There's additional money to take people off the ID waiver, 250 people. There's 4 million more to help expand access to rural home health care providers, which are lacking around the state. Increases for intermediate care facilities for intellectual disabilities, those rate increases. There's tiered rates. You've heard a little bit about that. So the more complex needs patients, there would be more dollars following them to help provide for those needs. There's child psychiatric rate increases. You see all of the stuff here on this list. I also wanted to note that one of the bills that we were following helped provide access to transitional education programs. So for those young adults coming out of high school that have an intellectual disability or a developmental disability or a learning disability, they can't use traditional college scholarship programs for those post-secondary transitional programs. There's 2 in the state. University of Iowa has one, and Northwestern University has, or Northwestern College has another up in, are they in Orange City? I think they're in Orange City. There's 2 in the state. So this would set up the first time a scholarship program that could be used for that, for those individuals, so that they can have that college experience and transition into adulthood. So that is in the House budget. But again, we don't know where the Senate budget is. They're $80 million apart, and 33 million of that is in the Health and Human Services budget. So you can see the nervousness about what happens in these final days, because there's a lot here that meet, I know, the Iowa DD Council's legislative priorities, and probably a lot of your priorities, the folks on the call, feel that this is important as well. And so these final days of negotiations, it's really, the budget is in the hands of the Senate right now. And so if this is important to you, I think it's really important to contact your senators and ask them to take the House budget.
Yeah, Amy, and just to kind of tell just a quick story, I mean, we kind of saying the same thing since the first slide is everything's at a standpoint. It's kind of frozen until they can agree upon this budget. And in the detail of the budget, these are things that are affecting people in Iowa that are living with disabilities or their families. Last week, and I told you about this, I received a call from a family member whose adult child has been, or adult, her child was on the waiver, and now they're an adult and receiving adult services. And she has received services for a long time, and she saw our newsletter, and she has concerns that those dollar amounts that are in there are actually going to change the care. that her adult received. Sorry, I made that mistake. But so I explained to her where it was, that it was in the House and the Senate wasn't hearing, so she knew that she had to advocate with her senator. But when we went through each line item, she said for her and her family, because they live in rural Iowa, that third bullet meant the most to them. And so I said, make sure you bring that point up with your legislator to kind of focus on where you're at, but also what other priorities. She said the waiting list concerns her because she knows there's young kids that need services on there, but also staff wages. That in our conversation, that became the largest one. But as I explained to her too, is that, there was a great opportunity for her to share her concerns. And then from that standpoint, we invited her to the Medicaid town halls that have been happening. And she was going to bring that point forward to Iowa Medicaid, that she just had concerns that those dollars would end up in the pockets of caregivers, or they would end up in improving services for people in Iowa. And I said, make those 2 points, make them really clear. So she used our Take Action Center to make contact. She's reached also out to Iowa Medicaid on her own, but then also is attending the town hall. And I think those are great examples of, while the budget's kind of in a stalemate right now between the House and Senate, it doesn't mean that you can't keep advocating. And so what you're saying is, this is what the House's budget is. And probably everybody else understands this, but I'm just saying it again for myself, is the House budget has been sent forward to the Senate. And the Senate is waiting on this voucher system with school, but it doesn't mean that they're still not on the same page with the Health and Human Service budget. So this is a great chance for you to say, these are our priorities. It doesn't mean the other things aren't important, but what is important to you? So
yeah, and that I haven't been, oops, got feedback. Are you still getting feedback?
I can hear you. Okay.
Okay. For some reason, I was getting feedback. So I think, yeah, you make a good point, Bill. A lot of people were concerned that those dollars weren't going to go into where they needed to go. And I think legislators did a really good job of putting language in the budget of how it's to be used, so it wouldn't just go into a MCO contract and then not get into the hands of the people that it was supposed to get to. But yes, I mean, we're at a standstill. But one thing I wanted to note, April 1st, I put up a special alert on our Action Center that, and it wasn't an April Fool's joke. I don't know why I did it on April 1st, but we put that up. And since that time, we've had over 100 messages sent on that. And so a lot of people are using that to help support the funding for community-based services. So I think that goes to show you that that is a really strong concern among Iowans with disabilities and advocates out there. So I encourage you to use that. We have a pre-written message. I always tell people, please just tweak it a little with your own story, add your story, because that's what really makes a difference. And I don't know, was it 2 Capitol snapshots ago, Bill, where we actually showed how those advocate stories make it into the comments that legislators make on the floor?
Yeah.
We hear it all the time, and we keep telling people, and I don't think they believe us. So we added some clips in those snapshots because they really do get repeated. And that's what makes legislators actually take action for someone, is when they hear those stories. It's hard.
I think it reinforces to everybody who's on the floor. If they say, just for example, if they say, Bill Collistad from Des Moines, Iowa, or Amy Campbell from Johnston, here's their email, and they're actually referring to someone that they're representing there on the floor. And I think that connects with people from both sides of the parties to help them understand what the issue is. And they often read and quote directly from those emails. So we're kind of sounding, we're kind of beating the drum on that, but it's an important message. Sometimes I don't think we feel heard, but we sit in there and we get to hear them quote those emails on a daily basis, especially when the bills come to the point for vote. That's when you really hear it very clearly. So,
well, maybe before we go to the next section, if anybody has any questions, I'm sorry, Chad, I just saw your hand was up. I don't know if you have had it up for a while. Okay. I don't know if there's anything in the chat, Bill. I can't no way.
Yeah, I think that Chad asked a question earlier about and he can speak to, he asked a question earlier about the voucher system, and I tried to clarify that there. And then, he has the comment here about that we do have a party that has the majority, and that sometimes we feel like they're dismissing the needs of, in his case, a single father or kids with issues, and how that has a trickle down effect. And I think those are, my comment would be more, we've got to figure out a legislator, and I know Chad's a great advocate, and I know he has spoken to many people from both sides of the party, and I'm sure he'll share his part of that story. But there is some of that. I think we gave some examples of sometimes those bills take a long time to get through, and so sometimes they're not as fast as we'd like them. But go ahead, Chad, if you have another question for Amy and I, and then we can.
Yeah, it's just quick. I got more, but just about the vouchers. So I read a little bit about it. So I'm trying to figure out if they're just trying to get kids with special needs out of public schools, which I think, I don't know if it'll help. It might help, but I seem to have problems all the time. Like, for instance, I can't even get into my school to view my child and how he's being, handled in the school. But my case manager for a mayor group, she could go in and she could go ahead and visually lay eyes on my child. So I don't understand like why that is.
Yeah, I don't know either.
Well, that's my point. There's all kinds of things going on that no one knows, but there's no central hub. Who do I go to bring these issues to that can help? I mean, it boils down to representation in my mind. I mean, yeah. I could bring anyone here to my IEP meeting or to reach out to the school. I've had senators reach out to the school, but again, it doesn't seem like there's really no power with the schools, and it's very frustrating. It makes it hard for me to trust the school. So that kind of makes me lean toward the vouchers, right? Because maybe that's what we need to do, is get our kids out of the schools because they don't want to deal with them. So I'm really confused with a lot of it.
Yeah, I think, well, just I don't know how to summarize, because I understand what you're saying, Chad. I think that the voucher in a very specific way, the voucher system they're talking about is just money to support any child. It could be a child with disability or a child without. And I know that we're talking about it in the DD Council, so it sounds like it's very disability related. It's not necessarily. It could be for any child to follow. So right now there are funds that allow someone to get money to receive services in a public school. They would like to have some dollars designated to have that any child have that follow them to a private school. So that could be a child without a disability, or it could be a child that does have a disability. And then what you're talking about specifically there, I do know that we've heard that before from senators or other family advocates up there, that sometimes there are rules that schools make that could be specific to a school. It could be also very specific to a district and how they allow for. And so kind of going up to the top part, sometimes we hear those conversations be brought up by senators, and they'll propose a law that would change how the kind of rules that a school could have that would allow more access to a family member. And I have not heard a bill this year specifically about families on site at schools. So those are a few different topics, but I hear what you're saying.
I just wanted to make one point of clarification. It is specifically the voucher program that the governor put together is specifically for low income kids. So under, I want to say 400% of the poverty level. And then those that have individuals with children with disabilities. So there's two.
It is, that's right. I'm sorry.
Yeah, it's two populations. It's not any child, but it's any child that meets one of those categories. The one thing that I've heard as a criticism is it doesn't cover the whole cost of a private school. So there's still a parent share that's probably not surmountable for a lot of low-income families, which might make that population have a harder time accessing it. But I do know that there were a fair number of families that were advocating for the special education bill that also like this bill. So we're covering it because we know that there is some interest and some opposition to it. in the advocacy community. So the DD Council, Bill, you guys haven't taken a position on it, have you?
No, we have not. Sorry.
Just one more thing. So it's so hard to deal with the school systems. How are people supposed to contend with them? I mean, I believe that my school's not even abiding by laws. I mean, we got a child that can't speak that gets 15 minutes of speech therapy every week. 15 minutes, he can't speak. I mean, I've been all around everywhere and I can't see anyone that is happy with this. We have to find speech therapists outside of school, and then we have to drive there, of course, right? Well, that's interrupting Iowa's Republicans' mandate on work over everything else, which I get. I want to work, but these kids need the help. I mean, I'm stuck right now inside of my head on how I'm supposed to just basically push aside my son's education. Now, this is a kid that's going to possibly live with me for the rest of my life. You know, they're telling me to go work at McDonald's. I'm like, no, I need a career. I need to go back to school, which that's what I'm doing, trying. But I hear a lot of talk about doing this or that. And honestly, there's a lot of it that it doesn't seem to really address any of this stuff. You know, I mean, we need representation out here. We need a special education bill of rights. You know, I mean, we need a bill of rights that pertain all across the state of Iowa that is the same for all school districts, that they have to comply by. They can't just keep parents out of the schools. I seen one bill, they proposed cameras in the schools, right? I mean, a lot of people disagree with that for many reasons. But in that bill, it said, except for inside of special education rooms. What? That's where we need the cameras if we're talking about cameras. I'm just saying, I'm making a point with that. You know, yep. These kids get abused all the time. Again, we all know my son was a victim of abuse. He's nonverbal. So if we don't want to crack down on abusers, we need to help kids learn how to talk, right? Let's figure out a way to give them more speech therapy. Let's figure out a way so parents don't have to take their kid clear across town to get speech therapy or OT therapy. You know, I mean, let's make it so it can be done in school. You know, those are just some of the things, and maybe through messages or emails, I can get information on bills or something that have to do with that. I'm trying to keep up.
I think there's two things. The one that was sent to the governor that I mentioned before on the special education task force, I think that is actually something that's going to be a part of that discussion, because that is entirely what that focus is the fact that it's not, the service delivery of special education is not uniform throughout the state. Depending on which AEA you live in, they have different rules. And so that group is going to specifically look at that. And I can't remember, there are parent members on that task force. So that might be something you want to volunteer for, and we can follow up with, yeah. Do we have your email? If you could put it or send it to Amy at ialobby.com. I can try to figure out how to connect you with somebody to get on that task force. Or, you know, at least we'll be covering it. So at least they'll have public testimony times on it. As well as there's so much in that governor's education bill that I'm trying to remember the exact language, but there's some language in there that doesn't require the special ed person at your school to sign off if you're going to get additional private education with that, or private, not education, but like therapy services outside the school that the school would pay for. You don't have to get their sign off. So there's quite a bit. That Parents' Bill of Rights in there is all on the education or material stuff, but I think that same concern has been driving a lot of that as well. Is
one last thing. How can I get a breakdown of the money that is sent to the school for my son? So there's state dollars and federal dollars. Is that correct?
Yeah, and private, or I mean, local dollars.
Yeah. Currently, that's how that works. How can I get a breakdown of how much money goes to my school for my son and what it's spent on? Is that possible?
It should be. I'm gonna have to think about that because I don't do a lot of school funding formula stuff. So that we can follow up on.
Yep, because I've asked for a bunch of accommodations, and I don't just say, hey, I want this. I go around and I talk to doctors, I talk to other school districts, and I also look at my son's ability, because again, I think when it comes to our kids' behaviors, the parents know best, right? Isn't that how it usually works? I think it's specified all throughout, different ADA and IDA that, the parent is the expert when it comes to their own kids, especially these kids. But I get denied a lot of stuff. So I wonder, where is this money going then? If you guys don't want to even buy an AAC device for a child that's been using, the PEC system for 3 years, I mean, I can read up and find out that it's good to introduce these kids to many different systems, right? Because one might interest them more than the other, and it's just another tool. But I've been denied all kinds of stuff. I almost feel like it's retaliation, and because I advocate. And again, I have no other choice but to think that. I mean, they let my case manager. I mean, so again, that's all I want to know. If anyone can give me any information on that, I will do the investigation. At this point, it is vital that I do this stuff to find out, because we're not getting no help from the state for sure. I still can't work. I'm working on it, but they don't understand why. They have no idea what an ID waiver is, apparently, which right now it's helping nobody. I mean, maybe very few people, but it can't help me. It can't help me get back to work. So, it's.
Well, we can look into that breakdown, Chad, and certainly get that back. Thank you for those concerns. We definitely want to, Amy and I can try to figure out and collaborate together to kind of investigate and see if we can get a dollar breakdown for that, or we also have some resources we could reach out to. If we can move on just a little bit, because we do have one more thing that we want to have cover. Amy, I'll let you set it up, or maybe Brooke, you want to set it up and have a conversation about the Glenwood closing update.
Yeah, I'll just turn it over to Brooke, because we didn't want to not have just a few seconds to talk about Glenwood closure, even though we don't have a lot new to report, but Brooke's been really involved in that. So I'll just have her do that.
Thanks, Amy. Good morning, everyone. And I'm sure everybody probably on here has probably heard the news already. We mentioned it already today as well. The closing of Glenwood Resource Center. As you can see by the timeline, this is going to happen over the next 2 years. The slide shows the timeline, and it looks like, the doors are proposed to will close June of 2024. And there's also a website there that you can see that has more information about it. And just as a reminder, this closure is due to a response to a 2-year-long investigation the Department of Justice was in Iowa looking at, and a report you recall did come out in December that we did go over with a little bit in one of our Capitol chats with the issues that they found and the corrections that the Department of Human Services ultimately needed to make. I believe really DHS wanted to make a good faith effort in trying to fix what was wrong at Glenwood, but ultimately came to the decision 2 weeks ago that the fixes that were needed were too big to accomplish and to implement. And that also, because of the costs to do those implementations, would not be sustainable over time. They would not be able to keep up with the things that needed to be fixed. And so closure was really what they thought was their only option. The council does recognize, of course, that Glenwood is considered the home to many of those residents, and there are many there that's the only home that they know. So it is actually really, truly heartbreaking. And so we want to make sure that transition to wherever those folks may move to goes as smoothly as possible. It's also, of course, devastating for the hundreds of people that work there in the Glenwood community. But on a positive note, we do really hope that this will be seen as an opportunity for some of the residents that have lived there who do finally transition into the community setting that they've been wanting to. And we know there are some folks there that have been wanting to transition back into the community for a while. We currently, council staff, which is basically just Bill and I, but council staff do meet regularly with Liz Matney, who is the Medicaid director, and then Marissa Ianson, who is the Mental Health and Disability Service Division Bureau Chief, to keep updated on what is happening with Glenwood and with DHS. It does sound like, in recent conversations that we've had with them, that there are providers that have already reached out and want to expand services to be able to transition the Glenwood individuals, residents into the community. So that is some good news. Our provider network continues to be good advocates for folks and want folks to live in the community. So that was nice to see that there's providers that have come to the table to try and help DHS through this. Just so you guys know, some asks from you, the council is considering putting together a letter for DHS on the things that we want DHS to consider as they move forward with this transition. So if there are things you would like the council to include in this letter, please let us know. We can either hear your thoughts today, or you can email me or Bill, or put your comments in the chat. So just a couple of things then quickly with the Glenwood closure transition to address some of what's going on with the Glenwood closure, and then also to address the needs of the community. And we've talked a little bit about this already, but DHS has been working with legislators to increase the rates of providers to have that money specifically go to increasing wages of direct support professionals. And included in that, they also want to see that go to folks that are that provide consumer directed attendant care services and the folks that are under the consumer choices option. So not just for the providers, but also for those folks that are in those self-direction programs. And as we talked about that, that continues to be in the House Health and Human Services bill. They're also working with their federal partners, which is the Center for Medicare and Medicaid. I always get those two M's mixed up, but to increase the waiver slots so that people that are currently on a waiting list won't be bumped down longer. So they won't have to wait longer for services because of this closure. And then they're also, what we should see this week or this next week, I believe, is they're releasing a request for proposals to have an organization provide crisis services training ongoing to providers. So not just be a one-time thing, but to continue to be able to provide that type of support for providers. And then they're also building into that a 24-hour crisis line for providers, as well as respite services for providers, so that they can continue to work with folks that may have some of those challenging behaviors. And as I said, I think that request is going to come out this week. We talked a little bit about I think Bill mentioned the Medicaid monthly town hall meetings. If you're not attending those, please do. They have one at 4 for providers and one at 5 for members. And Liz Matney, I think, as long as I've been in this field, I think is really open to hear what the issues are. And so I do encourage people to attend that. There was one last night. There will be one next May 26th, and we can put that registration in the chat for you guys so you have that. Just quickly, some of the things that were shared yesterday that folks should know. The public health emergency that was issued by the federal government, basically in the beginning of the pandemic, we do believe that will soon come to an end. We're not sure yet, though. They have not announced the date, and I believe they have to give 60 days notice to announce that date. But during that time, for the past two or so years, people were able to keep their Medicaid eligibility, even if they did not continue to meet those Medicaid eligibility standards. So basically, people were not dropped off Medicaid during this time. But when the public health emergency ends, so will that flexibility. So people just need to remember they need to go back to meeting the eligibility guidelines, getting their paperwork in during their redetermination, all of that stuff, so they can continue to keep their Medicaid. So that's one thing just to note and be aware of. And lastly, one other thing that was shared last night is that people who were on, or who are on, I should say, the Medicaid for employed people with disabilities, which is also known as MEPD. There are many of those folks have been sending in their co-payments and their premiums that are due to be on that program, and that actually wasn't required during the public health emergency. So folks that were sending in their premiums will get that money refunded to them in a check. So if that was something that you or someone that you know that was doing, that was continuing to send in their payments, they will get some money back. So that's a little bit of good news. I think that's it, but if you do that letter that I mentioned that we want to send to DHS to just keep some things in mind about what we want them to work on with the transition. If you have some thoughts on that, please let us know.
Thank you, Brooke. And Brady, we're going to wrap up with you here at the end really quick, but just Amy, if you go to the next slide, I'm going to hit on the primary, and I'm going to try to do that in about 3 minutes. We had a lot to cover today, and when the legislators weren't working, you'd think we could make this a little more brief, but there's always, it's always great to have the passion of the advocates. But I want to remind people there is a primary coming up June 7th. We do have a video that's out there that I did with the Secretary of State. When my son saw this picture, he said, "Who's laughing at whose joke in this picture?" Because we're both smiling. I'm sure that he was not laughing at my joke. So just seeing if people are still listening. And so really quick, June 7th, there's a primary. Redistricting happened this year. So you want to make sure you know who's voting for you and where they're voting. Put a plan together. One of the things that he had said in that video, I think that's really does a great job of explaining how to make a plan, how to get there to vote, whether you want to vote absentee voting or in person. One thing I would tell people is my voting place has changed for the first time in like 60 years. So they have moved some of the sites due to a lot of different reasons, he said. So just really make sure, don't just show up that morning and think it's going to be at the same junior high that it's been at for 50 years. It might have moved, but it did give some examples there, how you can get help, who's on your ballot. They can provide sample ballots, but some key dates. The last day to pre-register to vote in the primary is May 22nd, and you do have to declare a party. You have to say you're Republican or you're a Democrat for the primary. May 23rd is the last day you can request a absentee ballot, and they have to be received in the county auditor before the end of the day on June 7th. Reach out to your auditor if you have questions. Reach out to us. We can help you clarify that. We do have that video that is on our website, and he does a great job of explaining all the specifics and if there's more information where to get that you'd need from. So we do have only about 3 minutes left. Brady,
Bill,
you want to, Brooke, go ahead.
Yeah, there are 2 questions that we should get back to before we turn it over to Brady. Amy, I'm not sure if you saw that, but Chris Eisman had a question about, is it still alive to reduce the number of AEAs? And is that still part of was that part of the education bill in the House that passed?
No, so the education bill hasn't passed yet. And the AEA reduction bill is still alive. I don't think anybody's talked about it for a while.
Okay, and then the other one is from Paula Conley. How will the Special Education Task Force work with the existing state special education advisory panel known as SEEP? Is there language in the bill that addresses that?
No.
I think that looks like that's all of our questions.
Okay, Brady, I'm sorry your time here is so brief. I know Brady, I'll let you tell your story. With the Woodward closing, Brady's directly affected and has done a great job kind of explaining that and talking about his advocacy. So thank you, Brady.
Yeah, guys, thank you. It's I found out at work a couple weeks ago, and I'm just heartbroken. Everybody here in Glenwood is all in this together, and we need to be here to understand what's going on and support the individuals, the staff, the families, the guardians, the clients, because there's a lot of clients up there that understand what's going on with this, but they have no clue on what's going to happen next with them. Something that we really need to focus on here is, I had a client come up to me and say, "Well, I'm so happy the Glenwood Resource Center is closing. That means I get to go in the community." And I said, "Well, you might want to start thinking about where you're gonna go, because it could be a lot worse than where you're at now." And I've been really trying to strive to explain to people that I'm so tired of hearing about all the negative stuff about Glenwood. We need to focus on the positive success stories like me and some of the other people that have lived there. I just feel like that people are not hearing the good success stories like they need to. And we need more of that advocacy.
And Brady, one of the things that we've talked about too is that now the decision's been made, how as we as advocates and individuals that have life experiences can tell and work with the state to make sure that the transition plan goes, the decision's been made. Like you said, there are individuals who are living there that are going to have to make a transition and make it smoothly and that it goes well and that's supported financially through direct wages or all of those good things. But just knowing, Brooke laid out some of those things, whether it's respite care for someone who's in crisis, or that'd be an additional service or kind of a new service. If it's ongoing behavioral support training for, community-based providers, so they have that. And like you said, Brady, also choosing where they live. One of the advocacy points in that budget is that there are rural support services. And so this is a chance for us to even to share that message more. And like you said, these are people that are affected. Let's not forget that these are individuals that either that has been their home, right, and has been there for a long time, where they felt that was positive, and it doesn't necessarily mean it's going to be better unless we do that right. And so I think to your point, it gives us an opportunity to not just, just maybe experience it, but also to advocate for all those individuals so that the transition goes as smoothly as possible, right?
Yep.
Thank you, Brady. We're thinking of you. You did a great job in that presentation. You speak from the heart of advocates, so thank you. Kristen, did you have a question?
Yeah, quick question. I just saw this next month's meeting is on a Wednesday. I thought these were always held on Fridays of the month. The last Friday of the month. Why would it be Wednesday instead?
We had to change it because the last Friday of the month is Memorial Day weekend.
Okay, that's making sense to me now. I'm like, wait a second, you changing the day of the week on me? That makes sense. Thank you.
We talked about moving into June, and we thought people would start on, there were 100 emails. Thank you, Kristen, for catching that. That gives us a reminder that it is that Wednesday, and we'll make sure that people hear that a number of times.
Yeah, because I'm like, oh, it's always on a Friday. It's always on a Friday. So yeah, that's where I was getting lost. But Memorial Day is a very good reason.
And we moved it to noon just in case so that people could do it over their lunch hour instead of 11. So those are the two changes. And all three of us, Bill, Brooke, and I are all gone on the 20th, the week before. So that's why it was didn't move just Fridays, but just moved dates. So thanks, everybody.
Well, thank you, everybody. And I just want to end with just make sure, if you get a chance to go into our Take Action Center. I know we've been kind of talking about that quite a bit, because you can get in there and kind of talk specifically about a bill or reach out. And I know there's a lot of great advocacy. After our last Capitol chat, Hugh did that. I'm going to point out Hugh is one of our council members, and he followed up on a number of bills, and he said he was really encouraged from his response. So I want to thank people for acting on the information given. So everybody have a good Friday. Anything else, Amy?
No, have a good one, everybody.
Take care, everybody. Thank you.
Bye.